Dr. Kevin Kavanaugh is a retired physician, and a number of years ago, he started a group that has grown and grown and grown, and I think even probably beyond his expectations, called Health Watch USA. Dr. K, good morning.
Good morning, Jack.
Am I right? Has this grown beyond what you ever thought it would?
Yes, it has, especially it's spread across the nation and also internationally. We have a number of very active members in other countries, and it really gives you a different perspective, gets you out of the silo and the lens of just the United States. When you see what's going on in other countries, you realize this isn't political, it's a public health emergency, and we're slowly getting out of this. But as I've said before, we need to follow public health advice.
And you have a big online sort of seminar that happens every year. That's coming up, right?
That's correct. That is coming up next Wednesday on September 14th. If you'd like to go to this webinar on worker safety and COVID-19, go to healthconference.org and register. It's free. If you're a medical professional, there's continuing education. And I feel that it will really kind of open up your eyes because you'll get a different perspective from people around the world. And some of these are world authorities. We have Lydia Maraska. Dr. Maraska is known for aerosolization and indoor safety. In other words, this virus is airborne, and what do we need to do to make indoor places safe? She was listed as Time Magazine's 100th most influential people for 2021. And we're quite lucky to have her. We have Dr. Dale Fisher from the WHO Committee on Pandemic Preparedness. He will be talking. Dr. Jocelyn Elders, past Surgeon General, and also Ambassador Dr. Deborah Birx, who will be talking and discussing how the United States maybe could have done things better and what we need to do to prepare for the next pandemic and what we should be doing during this pandemic. And so it is a very good lineup of speakers, and I encourage everybody to go to healthconference.org, look at the agenda, and if you're interested in this, sign up.
Give us your assessment as to what's going on here locally in the state. How are we doing?
Well, overall, Jack, we're just not doing that well. I mean, we have approximately 58% of our populace that has been vaccinated by the 2-dose vaccine. We have only 27% which has had a booster. That's just a single booster shot. And we need to be doing better. It looks like rates are starting to fall a little bit, along with the positivity rate. It's now 18.5%. And nationally, they look like they're falling. If you go to the Walgreens positivity rate site on the internet, you can see that rates across the United States are starting to fall. So that's the good news. Bad news is we're heading into the fall and the winter where people tend to congregate indoors. And so we have to be concerned that rates maybe will start to go up. And even at the rate there are, although it's not a huge surge, we have close to 500 deaths a day nationally and a number of people which are getting inflicted with long COVID. And so it is not plateaued at a level that I feel is safe. We want to get this lower. And long COVID, Jack, is a huge problem right now. And it is one of the main reasons why you want to go and get vaccinated, let alone you'll have a decrease in incidence of dying and getting severely sick. That is, I think, two of the biggest reasons. For example, if you're over the age of 50 and you're unvaccinated, you're 14 times more likely to die than if double boosted. And if you have had one booster shot, you're 3 times more likely to die than someone that has had 2. And so that's pretty telling. And right now they're recommending an additional booster, a BA.5 booster that will be targeting the variant which we currently have. And so if you're greater than 2 to 4 months out from your previous booster or from your infection, I would consider getting a booster shot in order to get you prepared for the fall and winter.
All right. Thank you so much. Good luck next week. I know you'll be busy preparing for your conference. Won't have you Monday, but we'll talk to you in a couple of weeks. And thank you so much.
All right. Thank you, Jack.